right, you ready?
Ready.
Let's do it again. All right. Hey, what's going on, guys? Stevie Riggs here with Rock 98.5. I'm here with my good friend Dalton from Ladd Dental Group. He is basically their liaison. Tell him your title and what you do.
Well, that's
over there.
fancy. I'll take that
liaison.
title. Really, I just try and not get in the way. So technically, I do some marketing and community involvement, but really, my job is to just try to be a pillar in the community to kind of talk about the importance of brushing and flossing. And I make this cheesy joke, but your teeth are high-priced real estate, and once you get those permanent teeth, you only have one go of it. So it's really putting that importance and emphasis up front, because once it starts to get to the point where you're in pain and there's decay there, then we have to get involved, and nothing fits or feels like your natural teeth. So if we can keep your natural teeth healthy, that is always the way to go.
I really feel like we lose our teeth too early because they don't appreciate
Yes.
it.
Yes.
We need to be able to lose it a little later so that way we appreciate what we have.
Yes.
And then
Yes.
we have a second go
Yes.
at it.
And we do full service dentistry, but again, we do see sometimes people coming in at a very young age for complete dentures. And that's just something we really want to try and push off as long as we can, because once those teeth are gone, the denture process is a learning experience. Our providers are very, very good at it, but there's a lot of things that you just take for granted in your mouth that once those teeth are gone, it takes you gotta relearn muscles. Your tongue becomes pretty tricky. It's a process.
It's a whole thing.
It's a process.
You don't want to do.
Yes, yes.
So-
Let's avoid that brush, floss. Come see us 2 times a year, every 6 months. We'll get your teeth clean, keep you on that healthy track.
And we're going to get into that right
Yep.
now with some questions.
Yep.
So I'm going to basically act like I never go to the dentist.
Cool.
And that way, anybody who's out there who maybe hasn't gone in
Yep.
a long time, because I know some people who are like, it's been 10 years.
Yep.
They'll know what's going on,
Yep.
because I'm sure there's been some advances and things in the last 10 years.
Yes, and
so.
Stevie on that, and then we'll hop in. Don't be scared, guys, if it's been 10 or 15 years since you've been to the dentist. Just come in. It's a judgment-free zone. Just the fact that you're there will be able to start addressing some of those concerns, because your teeth, it's the only bone in your body that does not naturally heal itself. Once decay is there, it's there until it's manually removed. So, now I do see, is that still going?
We're good. We'll just take yours.
Cool.
Yeah.
Cool.
My camera over on this side died, so we're just gonna steal this camera.
Perfect.
All right. So first thing I can is if I don't like my smile, say I've got some teeth that are crooked or overlapping or just discolored, what can I do to improve my smile?
Great question. So, and there's a couple of different things out there. There's obviously invisible braces that have been talked about a lot recently. That's a good way to move your teeth and get them in the right alignment. In terms of whitening, there's different whitening options out there. There's whitening toothpaste that work as well. So, really, the main thing for you guys, if there's something from a cosmetic standpoint that you guys want addressed, come in and we'll be able to run through all of that. Dental implants have been a thing in the last 10 years that have really taken a lot of market share, and we promote a lot just because I think it is the best replacement to a single tooth, or even when you look at doing bridges for multiple teeth, the best long-term solution for those types of indications.
Yeah, it'll be the most natural.
Yes.
Yeah, you won't have to relearn basically.
Exactly.
Yeah.
It'll feel almost as natural as your teeth do. Nothing's going to feel quite as natural, but again, it goes below the gum line, it goes into your bone just like your tooth roots do. It's about as similar a feeling as you'll have.
And if you were to break it again, would you just be able to at that point put a new tooth on because you already have the implant
and
part?
depending on what happens there, yes. The main thing being in why that the specialists, and we have specialists in our office that will look, bone quality is huge because it is implanted and
gotcha.
supported by your bone. So that's going to be a major key, and you'll still want to keep it clean, brushing and flossing, all that good stuff. But if just the crown of the implant runs into issues, yes, you don't have to deal with anything but that actual crown. The other thing that's really nice is, and how you can use it is, if you lose a tooth adjacent to that, you can use that implant that's already there and use that as a bridge.
Okay.
So then you can use that as an anchor and continue to use it that way. There's also, what I would recommend, going back to that denture conversation, is implant retained dentures are the way to go. So, and you can always use that if you've had an implant at any time in your life, you can always make a denture to fit on top of that implant. So that will save money down the road as well. So implants do give you more options for sure.
So even for myself sometimes, I don't know exactly what the proper regimen should be. So what should my oral hygiene regimen be
Great question.
proper?
Great question. So, and some of it will depend on if you're in a perio maintenance category or not. But always, always, always brushing twice a day and flossing at least once a day. That's going to be key. I know we get annoying in the dental industry always saying that. We don't say it for our fun. That is just unfortunately kind of the overall grind that it takes to really keep them very healthy and happy. Now, in getting into that perio maintenance conversation, when you'll come and see us as an office, if you're in perio maintenance, you're coming 3 times a year, every 3 to 4 months. If you're just in that regular prophy phase, it's just 2 times a year, every 6 months coming in. The big difference is if you're in that perio category, it's getting below the gum line and getting the plaque out there. If you're a traditional prophy, most of the cleaning's above the gum line.
And then with flossing, I know for myself, I can't stand flossing. It hurts because I don't do it enough. There's blood everywhere.
Yep.
So we had talked about how there is an alternative.
Yes.
And it's called a water pick.
Exactly, and that's been a cool and the dental industry continues to evolve. There's a lot of technology that continues to hit the marketplace for stuff like that, and the water pick's a great option. I have one at home. I'm not the hugest fan of flossing either, and it's nice, very quick. Every now and then you have to wipe the mirror down, but it's a good way to get in there. And again, a $100, $200 water pick is going to save you a lot of money in the long run, as opposed to doing fillings, root canals, extractions, stuff like that. So this really is. Dentistry's the long game.
Yeah, if it means that you're actually going to floss, then it's definitely
100%, 100%. And traditional floss works just as well. Not saying it doesn't, but sometimes it's more fun and convenient to use the water pick over the floss.
I imagine too, because I mean, just having a piece of string between your teeth is uncomfortable.
Yes.
So
yes.
Yeah, and it's almost fun to just power wash your teeth. So, all right. So, and you already did number 3 here of how often should I be doing a dental exam and cleaning?
Yep.
Twice a year.
Yep.
As long as you're in that first category.
Exactly. Yep. And you'll be able to come in, and this might get to one of those. The main thing being is just coming in for that comprehensive exam. From there, we'll be able to get that very individualized treatment plan for you guys, because everybody's smile is different, everybody's needs are different. We'll come across the board. I might end up getting into a conversation, but never let fear or anxiety keep you guys from coming in. We try and be as cost effective as we can. In terms of financing, we use a company called Care Credit. Very nice financing options available. And we also do oral conscious sedation, which, as you guys listen to the Rock Station, you guys will hear some of our ads on that. That is a very good way to reduce your anxiety coming in and having some dental work done, if that's something that worries you or kind of keeps you guys away from seeing us.
Yeah, that stuff. So is that even for cleanings? They'll even do that?
You can. No, we try and avoid it for a traditional prophy, just because really you don't even need to be numb for that. That's above the gum line. But some of our perio maintenance patients, yes, and there's a procedure called a scaling and root planning, where if you haven't been in a while and you have severe perio, they'll have to get in there, and you'll see some crazy videos on Instagram if you guys want. But scaling and root planning is the name of that. And we do have a fair amount of patients that will get sedated for that, because it's about an hour to 2 hour procedure depending on how many quads you guys have done, and we would recommend that if you guys have anxiety.
Well, I will tell you, when I had my wisdom teeth pulled, they gave me some pills, because technically I was supposed to be awake for that one, which is that oral sedation.
Exactly.
Okay, and within minutes, I could have really cared less what was going to happen.
Yes.
I gotta tell you, I was like,
yes,
I got no worries.
Yes. And Stevie brings up a great question there, because there's technically 3 ways to do sedation. There's nitrous oxide, which is the laughing gas. I'm sure you guys are familiar with that. We do that. There's oral conscious sedation. That's a pill form that you probably took, digested kind of through the gut. So you swallow it just like any other pill. We'll crush it up for you guys, and you guys swallow it. That's a really good way to do it. We do that for the low cost of $55. So we don't really want to have you guys spend money on things that aren't going towards actually getting your smile fixed and corrected. So the third way to do it is IV sedation. That is done intravenously. It's the most efficient and immediate response, because it goes right into the bloodstream. But that is a little bit more expensive way to do. Our oral surgeon will do that. But for select cases, normally we try and go nitrous oxide or oral conscious sedation. But if you guys want IV sedation, we do that as well.
Would oral conscious sedation be the cheapest version of all 3?
Yes. Nitrous and oral conscious sedation we do for the same price. IV sedation is a lot more expensive.
Okay. So, I mean, obviously, I drink tons of coffee.
Yep, me too.
So therefore, I'm gonna have some stains.
Yep.
How do I keep my teeth whiter?
Yes, great question. And some staining is natural. Really, for us, there's whitening toothpaste that works. We would recommend some of that. We do in-office teeth whitening that works as well. We don't try and do too much teeth whitening in terms of the health of your teeth because it does take off a little bit of that enamel. So we don't want to over whiten, but there's a lot of different ways to kind of get your teeth whiter. Brushing and flossing is still going to help more than anything, but using that whitening toothpaste on top will be huge. Main thing being, don't whiten if you have some of that periosensitivity, because that bleach, if it's been a while, we've had some patients that have been lit up by that bleach before. So make sure you come in and see us before you guys want to do teeth whitening, because we can let you know.
So one of my questions I think is really unique for you guys, and I really actually appreciate, is so basically the question is, what are your payment and financial policies and plans and
Yep.
stuff? But really for me, the question that I actually really enjoy is your Dental One discount program,
Yep.
which
Yep.
goes through you guys. And so if you don't have dental through work, if
Yep.
you're working part-time,
Yep.
you can still have it. And it's, I mean, right at the exact same cost as it would be as if you had insurance through your company.
Yes.
So
Yes, and it's a great cost savings, and statistically it's been proven it will save the consumer money as long as they're not getting their dental insurance paid for by their employer. So what makes our plan unique is, and for $172 you get signed up that covers you for 365 days. You get exams, you get cleanings, you get X-rays, all under that umbrella. And if you guys want to comment below, I can get more granular on that. But that's a really good family plan and a really good option. And why it's able to work for us so well is we do multi-specialty dental care. So you can go to any of our offices and get that 20% discount on almost all of your dental care needs. So that's something that we really try and promote, especially for that preventative care type stuff. Nothing beats Dental One.
and then where are your locations?
Good question. So we have a
I
big
need a
office here in
bunch.
Kokomo. Yep, we're in Kokomo, Greentown, really north central Indiana, Bunker Hill, Peru, Wabash, and then our most kind of centralized or central Indianapolis location is McCordsville. So
And then you're building a new one, right? I think
yes,
that's all you
yes.
guys are building.
So
a
we're
new
really
one.
proud. So right across the street from our current Wabash office, we're doing a standalone building that I think will help a lot and kind of continue to invest not only in the community but also into the technology that we're able to offer to our patients. So that's a big thank you for the support to allow us to do that stuff.
Last question before we're finished up here, which, by the way, drop any questions or anything
Definitely.
in the comments here. If you have any others that maybe I didn't ask,
Yep.
he'll answer those for you.
Yep.
So,
Yep.
So the last thing is diet. Things that you're eating
Good
can
question.
really actually affect
Huge.
the health of your teeth.
Huge.
What certain things should I be trying to stay away from as much as possible?
Definitely.
And
So
if I have to have them, what can I do about it?
definitely. Well, really, the sugary stuff is tough. The sugar really does break down enamel. Sticky things like Laffy Taffy and stuff like that has a real tendency to maybe pull out fillings or loosen crowns, things of that nature. Obviously, everybody still has them. I eat that stuff. If you are going to have that stuff, somewhat in moderation, and then try and brush your teeth relatively soon after. We also really try and avoid the sugary soft drinks. Mountain Dew, Coke, stuff like that can add up pretty quickly. Again, just in moderation. Not saying that you can't ever have it, but if you do, try and brush pretty quick after. The more water you have too, water's very good for your teeth, especially if there's fluoride placed in that water. So definitely
Rinse your
hydrate.
teeth
Absolutely.
basically with water.
Absolutely.
Yeah.
Yep.
So, other than sugary stuff, like, is there any, common, vegetables or things that are maybe acidic that are not necessarily good for your teeth?
Well, one thing that we have to watch a lot on is milk consumption, especially close to night for kids.
Okay.
Because milk is technically a carbohydrate, so your body breaks that down as a sugar. So you want to make sure that if you're having milk before bed, that you brush those teeth, because if you let that sit on there all night, that will start to kind of attack the teeth. So milk, obviously very good for bones, calcium, that good stuff, but make sure we brush it off because it can turn to sugar when the body metabolizes it.
So it definitely sounds, too, like nighttime brushing is the more important of the brushings.
Well, and I can't overstate that the hard part is one time a day, and we'll see a fair amount of patients that have that answer. We really need to. It's just nothing is going to be a better comprehensive way to get those teeth cleaned, and it's better when you wake up in the morning too. I'm I'm sure your partner, your family would appreciate having that nice
Yeah.
minty fresh breath as well. So I was thinking that Orbit commercial.
Yeah, right. So, I mean, for now, I think that's all my
Perfect.
questions.
Thank you, sir.
So,
Thank you.
if you have anything, like I said, drop them in the comments. He'll answer those for you.
Yep.
And I think we're going to try to do this again. So, again,
Definitely.
if you drop those questions, maybe we can even answer them in the next video.
Definitely. That'd be a good follow-up. Good follow-up.
Also, last trivia is apparently you are the mascot of Lad Dental.
Yes. The rumor is true.
The rumor is true.
When you have
Yes.
low pride, low ego, it's very easy to do a lot of things. So,
So,
yeah, just a side note.
If you ever
there.
see Pearl walking around,
Uh-huh.
unless for some reason Pearl's shorter that day.
Yes, exactly. But yeah, normally it's me. Just
All
make
right.
fun of me.
All
It's
right.
par for the course.
All right. Okay,
guys.
guys. We'll talk to you guys later, and we'll do this again with Lad Dental Group.
Awesome. Thanks, Stevie.
Yep.
Perfect.